Good morning, everybody. Welcome back to UABPT's COVID Corner. Let's get started with another question. So we've got quite a few questions about this next topic. And the question we're going to answer is, why is prone positioning important in COVID?
We've known about proning for a while, and the benefits of proning for patients that are in the intensive care unit. It just hasn't been utilized all that much in the past. Typically when patients are prone in bed, the lower lobes of the lungs get compressed. They can sometimes get secretions in them, although secretions don't seem to be a significant issue with COVID, with this viral pneumonia. But the heart can kind of compress the lungs, the thorax kind of pressing down, staying in bed, staying on your back for prolonged periods of time, ends up causing some collapse of the lower lobes in the posterior portion. And in the meantime, that section of the lungs is getting kind of good blood flow, because blood flow kind of goes to the bottom. The lungs get better blood flow to the bottom of the lungs, or the kind of the most inferior portion of the lungs. So when we turn somebody over into prone, now the bottom of the lungs that are have been kind of collapsed from compression start to open up a little bit more, and the anterior part of the chest is now facing down. It gets better blood flow, and so it's kind of open. It hasn't been compressed, and so you kind of get better matching of kind of ventilation and blood flow when you put these folks into prone. And so one of the benefits is that you see their the partial pressure of oxygen go up. So they're, when they do a blood gas of folks between supine and prone, after they've kind of been put into prone, their oxygenation levels go up, and they require less oxygen from the vent and perhaps less support from the ventilator. You can't stay in prone forever, and if you did, then now the front of the chest would start to kind of develop some of the same problems as the back of the lung. So ideally, the position would be, patients would sleep in the bed at night and they'd get up in the morning and they'd sit up, they'd stand, they'd walk around, but these folks are often in severe respiratory failure. They've been kind of sedated. There's a lot of emphasis on, keeping patients less sedated. And so when they are sedated, they don't need to be lying on their stomach if they're awake. They should be, kind of rolling over on their own. They should be sitting up. They should be getting out of bed, sitting in a chair, like you and I do when we get up in the morning.
Yeah, so you bring up a good point. Reading through some of the proning protocols that some hospitals have created, they're trying to keep these patients prone for 12 to 18 hours at a time. So let's kind of talk about the drawbacks of that.
When patients are in the hospital in supine, typically we don't keep them in supine for more than 4 hours at a time, before we kind of roll them onto their sides, because we're concerned about kind of pressure ulcers. And most Americans have more, padding anteriorly than they do posteriorly. So when we put people into prone, we think we don't have to, maybe we don't need to worry about pressure ulcers, but in fact, we are seeing patients now getting, pressure ulcers on their pelvis, on their sternum, in anterior locations from being prone for prolonged periods of time without pressure relief.
So we got some questions as well about how to prone. So a lot of hospitals have been creating these proning teams that PTs are a part of in some hospitals, which we'll get to in a minute. But proning is really a team effort. You'll have 2 to 3 people on either side of the patient. They'll use multiple layers of sheets and pillows to flip the patient over. And so ideally when they're laying prone, you want a pillow underneath their chest, their hips, and their shins to kind of float the knees and make sure you don't get pressure ulcers. So I know John and I have had a lot of discussion about this, and we'll kind of talk about it on film now. But should PTs be a part of a proning team? Is this a skilled service for physical therapy?
I think as PTs, we are kind of movement experts, and this is a novel movement for a lot of people. A lot of times nurses, respiratory therapists, different facilities aren't kind of accustomed to how do you get somebody from, supine to prone. So we're kind of the movement experts. But that being said, as PTs, I don't think our role is to, be the proners. And we don't need to be kind of going from bed to bed, putting people into prone and take them out of prone. but I think we could best spend our time kind of teaching staff, teaching the nurses and the respiratory therapists and the nursing assistants, how to protect themselves with good body mechanics and getting the patient prone, how to best position the patient to get into prone. It differs a little bit if it's a young patient that can kind of get their, arm up into full flexion. Then you can get the arm all the way over the head and kind of roll over that way. If it's a older adult that can't get their arm up very far, then you have to kind of tuck the arm in under them as you roll over. It makes it a little bit more difficult. So I think our role is primarily kind of educating other staff and how to do proning and how to do it safely for both themselves as well as the patient.
Yeah, I agree. And one thing I forgot to mention earlier, if your patient is intubated, you always want a respiratory therapist at the head of the bed to maintain the ET tube during proning. Typically not do this in one swift motion. You'll kind of get them to their side and then flip them all the way over. But yeah, I agree with what John says, especially since now we have appropriate PPE in a lot of hospitals. Our time as a PT could be spent with patients recovering from COVID and those that are able to sit on the side of the bed and get up and do exercise in the room.
Our time and expertise is best spent, like you said, Ashley, in mobilizing these patients and doing more active interventions.
So our last kind of thought about proning was, should somebody prone before intubation, kind of as a preemptive strike?
Yeah, it's not a bad idea. I actually, I'm kind of a tummy sleeper, so I kind of prone myself at night when I sleep, and maybe it's not a bad idea if you're experiencing symptoms of COVID to sleep on your stomach at night. But during the day, being up and active and taking deep breaths and sitting upright is going to do more for your lungs than laying down in the middle of the day while you're awake.
Absolutely. All right. Well, thank you guys for listening to our proning discussion.